Shivnami, Ops Gynec and Infertility Specialist. I have my clinic in Uttarali Main Road, Bangalore. It is Vivek Polyclinic and Eye Hospital in the first ground floor, and Vivek Fertility and Women Care in the first floor. Okay. Today I would like to talk to you about the various aspects of fertility. So first of all, I would like to talk about PCOS. So PCOS, what does it mean? It is polycystic ovarian syndrome. So there are certain criteria which have been put forward recently, which will determine whether the woman is having PCOS or not. So there are three. These they have been put down by the bodies like the NIH, ESHRE, and ASR. So which are the criteria? There are three criteria. Among the three criteria, the woman has to suppose to have two criteria at least to say she has PCOS. So let me tell you about the criteria. The first criteria is the clinical or biochemical hyperandrogenism. The second criteria is menstrual irregularities like oligo or amenorrhea or anovulation. The third criteria is the PCOS seen on the ultrasound. So let me tell you about the first criteria now. What does it mean by saying that it is clinical or biochemical hyperandrogenism? So first of all, so regarding clinical hyperandrogenism, so it involves certain symptoms like hirsutism, means excessive hair growth on the face and the various parts of the body. The other thing is the acne. Acne means pimples appearing on the face, back, neck, chest. And the other thing is the alopecia, means loss of hair, excessive hair loss, leading to various degrees of baldness. And the other thing is increase in the weight, obesity. The other symptom is acanthosis nigricans. That means it is a thick, velvety, cutaneous plaques which are seen on the back of the neck, on the under the breast and in the axilla, that is the armpit, and on the knuckles and elbows. These also happens in the clinical hyperandrogenism which is involved. Next is the obesity, central obesity. So this completes the clinical hyperandrogenism. Now comes the biochemical. Biochemical means certain blood tests, that is the total testosterone, free testosterone and the free androgen index. All these are raised in PCOS. Some few people are there with PCOS whose androgen levels will be normal too. So this is about the clinical and biochemical hyperandrogenism. This is one criteria. The next criteria, menstrual disturbances. So what are the various menstrual disturbances can happen in PCOS? There may be no menses at all. There is amenorrhea. And then comes the oligoamenorrhea. That is cycles happening for more than 35 days. Occurring more than 35 days to 60 days it may go. And these are the various irregularities in the menstrual cycle. Some may be having excessive bleeding or some may not be having any bleeding at all. So some patients may have normal regular cycles too. So this is about the menstrual irregularities. Next comes the PCOS, which I told, which is seen on the ultrasound. So the recent guideline says that the follicles which are present in the ovaries, they should be more than or equal to 25 follicles minimum. So if the radiologist says that the patient is having bilateral PCOS or whatever, then you need to see how many follicles have been mentioned. Okay. So if it has to be at least minimum more than equal to 25 follicles. So then only you can say that the patient is having PCOS. Other feature in the scan is the ovarian volume. It should be more than 10 cc. So normally also the follicles are usual. Normal follicles also may be from 14 to 16 follicles. So that is a normal thing. If it is less than 8 follicles, we call the reserve to be very low. But in PCOS, it should be more than equal to 25 follicles. So keeping this in mind, only if this criteria is met, then we can say that patient is having PCOS. But just with few follicles peripherally arranged, these just cannot define PCOS. This is a recent guidelines. So this is about the PCOS on the ultrasound. So I have told you about the three criteria. So if a woman is supposed we are to diagnose her as PCOS, then 2 out of these 3 criteria have to be seen in the women to say she is having PCOS. When these criteria are met, then you need to get yourself evaluated with certain blood tests which your gynecologist will be able to tell you depending upon your problem. Today, I would like to also tell you how this PCOS causes various health issues in a woman. So, firstly, it causes obesity. The others are the cardiovascular diseases, hypertension, type 2 diabetes mellitus, renal and vascular diseases, and also infertility and obstetric and gynecological problems too. Obstetric mainly repeated miscarriages or abortions, and gynecological cases like excessive bleeding during your cycles, or endometrial hyperplasia, or endometrial CA, that is uterine cancer too. So these are all very serious problems. I'll be talking about PCOS and its effects on infertility and the various treatment options available for infertility in my next video. Thank you. I have also posted my clinic address and the various facilities available in my clinic under the video. Thank you. Please visit.